Hello, everyone, and welcome back to what's quickly becoming my favorite type of podcast, our Q&A monthly podcast. This is the Pain Free for Life podcast episode where I take questions that have been submitted to me through our Facebook polls, as well as by email. And we kind of look at whether they're popular questions, whether a lot of people want the answers, and then I answer them live here. So if you have questions, feel free to submit them. You can email us at support, or you can post them on the Facebook group. They might just make it into a future episode. Now, for now, I think we should get started and take a look at some of these pretty in-depth questions that people have asked this time around. And, keep them coming, guys. I really do enjoy these ones.
Welcome back to Pain Free for Life, where we share how to successfully overcome all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And now, here's your host, co-founder, and board-certified holistic healthcare practitioner, Dr. Rob Vanbergen.
All right, so the first question was kind of a vague statement more than a question, but I think I can kind of work around it, and it's been quite popular already, which was meridians and acupoints with microcurrent. So I suppose if I were to phrase that around like, how do we treat them? Why do we treat them? When do we treat them? The first thing is that by doing any treatment around the body on with the microcurrent device, you're going to be inadvertently hitting meridian points, right? These meridian points, they are everywhere on the body. So just by taking your device and painting over the arm, you're going to hit some meridian points. And meridian points want energy. So they seem to almost like suck in the energy like a sinkhole. So it's going to provide some sort of benefit without you even necessarily realizing you're doing it. These are pathways through the fascia. So they're incredibly important to get any amount of healing out of the body. Just to have that fascial connection so that the systems can function. Now, when we're deliberately looking to do treatments with microcurrent, we are looking at specific tools and we're looking at specific locations. So let's talk about when we see the use of these most commonly. If you have our textbook, Current Medicine 3rd edition, if you've been looking through that, you'll see that occasionally there is a 1, 2, 3 to, I think even like one of the protocols might have 5 or 6 different meridian points listed in there. Now, meridian points can be additional areas that can help assist with a condition. And for the most part, when we are treating, we want to use our pencil electrode. And, I may be biased because we produce this one, but the Sana pencil electrode is definitely easier to use than the Avasia one. The Avasia one looks a little bit fancier because it has a little curve on the end, but it has a bit of a sharper tip, which just makes it harder or more uncomfortable, whereas this has a soft sealed tip. In addition, the Sana pencil, with dealing with meridians, you may need to put a small amount of a conductive gel on the body first. Any pencil electrode, it's such a small electrode tip that you really need to be able to increase that conductivity a little bit, especially for people that are dealing with dry skin, dehydration, anything like that. We want to be able to push that through. So essentially stimulating those points is the way to go with the pencil electrode. Now, you can do this with other electrodes. You could do it with the face electrode, which is a much larger electrode in the grand scheme of things. But, for most people, trying to do the meridian stimulation with the pencil is going to be the optimum choice. Meridians are not always necessary in these protocols, and you'll see that we don't use them as you have to do these in many cases. But there are some conditions where you are going to be required to do them. And bearing in mind, you're going to be helping to restore the balance of these meridians pathways as you're treating anywhere and any way. There is also something we don't do ourselves practice-wise, but for acupuncturists, we've developed a special wire bundle, which you can't get on the store. You have to contact us about, but it allows you to use needles with the microcurrent. So they can actually place the needles in the points and stimulate up to 4 of them at a time per device without any additional discomfort, but providing the body with all that extra energy that it needs and utilizing their expertise. But meridians and acupoints, they're the sorts of things you're going to find that you're inadvertently treating. They're going to be a big part of many different protocols just by virtue of what they do and what they can achieve. So when you do see them, don't just glance over them. If they're in a protocol, they're there for a reason, and try to work on them. Typically, when we're doing this, we can just use a generic protocol like our blue stimulation and stimulate for 5 minutes, and we can get the benefits. But also bear in mind that meridians tend to have two sides to them. So if you're treating a meridian on your right arm, you're going to have the same meridian on your left arm, and you're going to want to treat both sides. There's a balance that we have to obtain here, and it's really just restoring that balance and that voltage to those channels so that they can start to work better. Great question. Very in-depth answer as far as like how it works. And honestly, meridians by themselves could be an incredibly long lecture just to understand them in any way, shape, or form. All right. So our next question is wound care. So how does it work? Why? What types of wounds? These are all really good questions. And when it comes to wound care, we're dealing with typically what we call non-healing wounds. So what is a non-healing wound? So obviously a non-healing wound is a wound that is struggling to heal and repair. So if I actually have had one I've been working on here, except it is healing now. I scraped myself on a cupboard when I put my hand into it, and it took off a bunch of skin, like many, many layers at once, and it was wide. So it just was not healing. And so simply by improving the circulation, by reducing the inflammation, and by triggering regeneration, sounds more complex than it does simple, you are just performing the wound healing process. Normally, a wound will get inflamed like any injury, and that will actually block healing at the beginning, but it will help to trigger the healing down the line. It brings in the immune system. But when you're dealing with a non-healing wound, you're typically dealing with infection or an underlying condition, such as diabetes, that just slows the healing process in the body. And then you need the extra steps to help. The good news is that we've worked with wounds aggressively in many ways, shapes, and form. In fact, my dad did a study for his PhD on non-healing wounds, diabetic foot ulcers specifically, in Malaysia. And some of these diabetic foot ulcers were so bad that you could look through the bottom of a foot and see out the top of it. They were very gruesome before and after pictures. Simply by applying microcurrent in its basis level, you're reducing inflammation, you're bringing in circulation. In and of itself, that helps to trigger regeneration. And that led to the sealing and the healing of these diabetic foot ulcers. They had almost, if not, I believe it was a 100% success rate. Every one of the 100 diabetic foot ulcer patients was getting results, of getting healing. Some were fully resolved by the end of the study. We've then since gone on to treat so many diabetic foot ulcers in these sorts of situations, but also additional wounds that would normally lead from gangrene leading to amputation, to infections in areas, to bed sores, to just cuts and scrapes that won't seal up, to post-surgical. Everything kind of falls into this wound healing pattern. So for all of the complexities of wound healing, for all of the underlying effects that microcurrent is doing, from the regeneration of the tissue through the addition of ATP, through all of these things, through the increased oxygen, nutrient delivery, blood flow, in the end, where are we shaking out with this therapy? What we are actually doing is the most basic microcurrent protocol alive. We're dealing with the inflammation, which we always have to deal with first. We're improving circulation, and then we are triggering regeneration, typically with a broad frequency. So something along the lines of our 350 hertz in the evolution, followed up by our fMRSI program. So that's the low blood flow frequencies, followed up by a stimulation program that's going to help to stimulate the tissue and bring regeneration back to the forefront. So wound care is one of those things as well that it's just incredibly impactful because it's something you can visibly see. If you treat someone as a practitioner who has a wound that is not healing and then it heals, wow, do they become a believer quickly. So it's definitely one of those things that's nice to work on because you can see the improvements on the surface instead of them being laying underneath. Now, we did have to actually repeat that study from Malaysia because the FDA did not count it since it happened overseas. And in fact, got Stanford University and Baylor School of Medicine on board with repeating those studies so that they were able to show that, yes, in fact, it does work no matter where you are in the world, which, of course, we knew that it would. And this is going to lead us to be able to get our FDA approval for wound care down the line. So very excited about that. Okay, so good question there. Next question I have here today is, can you describe how scalar actually is generated in your scalar chi and sana chi? Absolutely. So this is a pretty common question because people wonder, well, what is scalar? How does it work? Why does it work? Well, scalar energy is essentially a 0-point field. It's a creation of a field of low to no energy. This is good for the body because the body can resonate with these waves and they can start to repair and regenerate the tissues. So scalar has the ability to do so many things, from boosting the immune system to increasing regeneration to reducing inflammation to even just repairing damaged DNA, which can be great for preventative health and even useful in certain conditions such as cancer. Which I believe I'm talking about next week in another podcast episode. But essentially the way it works is when you're generating an electromagnetic field, so like a pulsed electromagnetic field, you have like a coil, and that coil is going to wind up with energy and then emit a field that is of that frequency. So if I were to put in a frequency to say 300 hertz into a PEMF, it's going to emit 300 hertz in an electromagnetic field instead of microcurrent. And this is how our devices power the scalar. The microcurrent enters the scalar, or it enters the PEMF pad, and it activates that function. Okay, so all said and done. We've got this tool now that can emit an electromagnetic field. But that's not a scalar wave. A scalar wave, remember, is an energy level of near zero. So how do we create scalar? Well, you take that one coil and then you take another coil, but you wind that second coil in an opposite direction and you face those coils towards each other. Essentially, with energy, when one signal that is identical hits another signal that is identical, it cancels each other out. So these two tools essentially built into the head of this device, the sana chi or the scalar chi, these coils essentially face each other and they direct the same identical level of energy into each other on either end, cancel each other out, and start to generate a 0-point field or a scalar field. So this is how it is generated. Now, a perfect scalar is undetectable. You're very rarely ever going to get perfect scalar in energy, but we get very close. And sometimes I swear we actually hit it. To get that scalar wave that is going to be able to heal the body. And the results we see with scalar energy are truly astonishing. Like, people do see incredible healing from so many conditions with scalar. And in cases where I'm not seeing results, scalar is usually the key to unlocking those results and helping the body to improve its healing process. Okay, so that answers that question, I hope. Next question. If I want to become certified to use this and open a business, but I am not a doctor, is there a way? Do I need certification, or can I just essentially start treating? Well, the legal answer is you really should make sure you get a certification, because you're going to want board certified insurance coverage in case you cause any problems or you have a client come after you. And you're going to want to be able to have that extra support as well from being part of a body that can protect you. So some doctors don't even have the ability to use these tools because it depends on their different states and their provinces and things like that. And so we did develop a program, actually, our Certified Pain Resolution Specialist program at the Sana Institute. So if you type in thesanainstitute.com into your web browser, you're going to actually find our website there, and you'll be able to look at the program there. If you complete this program, you will get essentially the equivalent of a bachelor's degree in holistic medicine. And in doing so, you'll be able to actually apply to the board, get board certified, and begin to open your practice and start treating as well. So you'll learn everything you need to know about the devices, the ins and outs, as well as some intro to nutrition, exercise, stress reduction, and so on to really build a holistic practice of your own. So there you go. Go ahead and check that out if that is something you are interested in. Okay, so next question. I am new to this, but I am astonished that tongue stimulation has been so effective for my essential tremors. Can you explain how it works? Why is stimulating my tongue actually helping? I don't really care how it works, but I would be interested to know if you don't mind giving an explanation. Okay, so first off, I'm glad it's working so well. Tongue stimulation astonishes me as well. And I remember it was a topic that I was very interested in when we first introduced it. And it's kind of just folded in as part of the treatment now. Now, first off, tongue stimulation uses our tongue stimulator tool. If you don't have a tongue stimulator, I would not do tongue stimulation. The reason is this tool is smaller. It's much safer for putting electricity in your mouth. It's going to make for a more comfortable treatment. And it's going to enable you to actually stimulate the nerves in the tongue. And that's what it's all about. So the tongue itself isn't actually fixing the issues with the tremors or with sense of smell or any of the things that are coming from the brain and the nervous system. What it's actually doing is it's acting as a bridge. And this is based on the research of Dr. Norman Doidge. So the tongue enables us to use the nerves within it to send the signals up that nerve into the brain through the pons. And when it hits there, it actually branches out to every cranial nerve in the brain, meaning that whenever there's a dysfunction with one of these cranial nerves, whether that be like movement, tremors, smell, vision, we can actually kind of get the brain to recognize those dysfunctions and correct it from within. But the only way of doing that is to find an access point, and the tongue acts as that access point. So simply by doing that tongue stimulation, you are stimulating your brain in its core, and therefore all of the other nerves associated with it. So tongue stimulation is one of those fascinating treatments that is treating something else to treat a huge array of issues. So for anyone dealing with essential tremors, Parkinson's, sense of smell issues, long COVID, brain fog, vision issues that won't resolve, hearing problems, tongue stimulation can be a potential option, because if it is related to the brain, then you're going to be able to correct those issues. So again, congratulations on how well it's working for you. But that's kind of a base level of how it's working. Without visuals, it's kind of hard to give. Otherwise, if I have like a slide, I could show the image of the pawns and go through all of these. But on podcasts, you don't really have that luxury. Half the people at least are going to not be viewing it. They're going to be listening to it. Okay, so we've got a few more questions on the docket for this episode. So this one is, I am working through the fibromyalgia protocol. I was working through the fibromyalgia protocol in Current Medicine 3rd edition, and I was trying to complete all of the points in one day. A friend of mine who got me into microcurrent noticed me doing this and said that I don't need to do them all at once. Can you clarify? So your friend is right. Actually, as far as current medicine goes, you'll notice that there are some protocols that are like 20 steps, and there's just a lot of them. And if you were to sit there and do all of those steps in one day, you'd probably be spending hours doing them. The way the steps are laid out is that the first step is likely going to be the most effective, then the second, then the third. So what you're supposed to do is you treat the first step and you see if you get improvement. Then you treat the next and you see if you get improvement, and you keep going until you hit that improvement point. They've been ordered in such a way that the most effective protocol is number one. And then we get to the ones that are resolving problems still, but they're kind of the ones you would do later on anyway. So you can absolutely begin working through that protocol by spending the day doing steps 1, 2, and 3. And then next day, trying step 4, 5, and 6. And let's say you hit step 5 and you find that this really helps. Well, step 5 can become your new benchmark. So you don't have to try and squeeze in a 20-step protocol that takes you 2 hours here. We're talking about using these as a guidebook to work systemically through the problem. So glad your friend noticed that on there. We do explain that in some of our videos as well. But it is a helpful approach to be able to break it down into more manageable chunks. Okay. And our last question for this episode, as kind of a bonus, I try to do 5, and I think I've done 7 maybe with this one included. This one's a nice and simple one. It says, which do you prefer, Dr. Rob, the 6-inch Y probe or the 8-inch, and why? Okay, so there is definitely times that I prefer one over the other. To be honest with you, I like having both. If I'm treating patients or I'm treating areas further away from my body, I like the 8-inch Y probe. So if I was treating my feet, I want that extra few inches of reach to be able to do it without being as much of a contortionist. If I'm treating patients, again, I like to be able to have that distance from the body so my hand isn't getting in the way close to the body. But if I'm treating myself, I really want to be able to work directly on the vagus nerve, for example, and have that more control without being further away. And I like holding the probe better for the 6-inch that way. So when I'm treating myself in a more localized, less distance area, I prefer the 6-inch. I do think the 6-inch has some advantages for kind of treating yourself. And that's kind of where I'll say. But then I've heard from other practitioners, they prefer the 6-inch for patients because they feel like they have more control over pressure with the shorter handle. So it is a little bit subjective, but for me personally, I do like both, but it depends on the situation. Am I treating myself? And am I treating myself like close to my arms, or am I treating my feet? Versus also, am I treating a patient and what I'm going to do with that as well? So hopefully that answers your question. All right, everyone. So again, I'm really loving these Q&A episodes. Keep submitting your questions. They will get answered if they get submitted enough. And we will include them on the podcast episodes in the future. We're doing one of these a month, so I've got so much room for questions. As I said, I'm going to try and answer 5, tend to answer more if I've got them. So please go ahead and keep submitting those questions. And until next time, you are listening to Pain Free for Life with Dr. Rob Vanbergen. Take care, everyone. Bye-bye.
Thanks for listening to Pain Free for Life. Be sure to follow us, share the show with family and friends, and leave us a review on iTunes. Every time you share the show, you are helping someone take their life back from pain. Visit painfreeforlife.com for more resources, including our free guides to microcurrent, the Hache protocol and inflammation, as well as our blog and online community full of people just like you, successfully overcoming all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And stay tuned for the next episode of Pain Free for Life.